Welcome to the Rotary Club of Edina, the #1 club of the universe. Yeah, baby. My name is Michael Stanzak, and I am humbled and honored to serve as your 67th president. Thank you all so much for coming out on this sunny and frigid Minnesota winter day. We have a very interesting meeting planned today with John Magnuson, Executive Director of the Minnesota Association of Resources for Recovery and Chemical Health. He's going to speak on the pathways to recovery, integrating mental health, substance use disorder, and well-being. You know, it seems like almost 2 years ago, John Batoff, that I asked our speaker committee to come up with someone that could speak about depression and mental health, because I think we have all been touched, either by friends or family or neighbors, with somebody that's maybe battling depression or battling mental health, and I'm certainly not an expert, so we are so excited for having John join us today, and the reason it was possible is because of our outstanding speaker committee and Katy Campbell, who is the public image director, who was able to get John to join us today. Thank you all for being here in person. Becky, how many people do we have today? A lot! Thank you all for being here, members and guests. And also for those of you that are joining us on Zoom. We love you, Zoomers. Greetings to Ken Larson, David Ozzie, Dennis Hikes, Kristen Huppenbecker, Peyton Price, Rob Bredding, Sam Coate, and Skip Thomas. And if I missed anybody, I'm so sorry. We're so glad you're able to join us via Zoom. For an update on our newest member of our Rotary Club, and I'm sure everybody is wondering who that is, right, Shelley? It is Miss Nora Elaine Idness, who came into this world on Monday, February 7th, weighing 9 pounds, 11 ounces, and measuring 22 inches long. Kaylin and her husband, Kyle, could not have been happier, but wait, there's more. Also, her older sister, Natalie, is getting to help out, and also her older brother, Will, is getting to help out. The next member spotlight is on our very own Dr. Hannelore Brucker, who is pictured with Dr. Didier Ebo. Hannelore explained that Dr. Ebo is a main researcher of cannabis marijuana allergy from Belgium, and after giving talks about this topic, she noticed that physicians in the general population had no knowledge about an allergy to marijuana. Paul, do you think people might have an allergy to marijuana occasionally? They could be. When I brought up the idea of a general information piece, Hannelore said, many scientists, allergists liked the idea. Eventually, an international work group was formed. The article was published in the January online in the European journal Allergy. As a result of this cooperation, she's listed as the #3 author, but author 1, 2, and 3 are considered joint first authors. Let's give Dr. Hannelore Brucker a hand. Thank you. In keeping with the birthday theme and the girls just want to have fun theme, there is our very own Jennifer Hendrickson, who last week was in the Bahamas with Lindsay Smock. And Lindsay, right, I am so lucky to spend Jen's birthday with her. This lady spontaneously decided to try diving while she was on a bubble watcher in my dive boat. Then was brave enough to go into the shark feeding tank. Way to go, Jen! She's totally a bad person. First dive for her. Happy belated birthday. Also, another member spotlight involves Ken and Jean Anderson's granddaughter, and he writes, today was a big day for our granddaughter, Sadie. It was her 14th birthday, and as president of the dog treat company Wigglebutt, I don't think Sonia Tignan's out there, maybe she could team up with Wigglebutt. She was interviewed by Kathy Wurzer, who Jim Ryman knows and sat next to on NPR. Apparently, Sadie was fabulous, displaying poise, friendliness, and knowledge. Jean and I are so proud of her. Congratulations to Ken and Jean, and most of all for Sadie for the great job she did being interviewed by Kathy Wurzer. Who says Rotarians just ski? There is our very own Sutton McGraw with her friend Ryan Walters at Playa Indio Isla Muras. A little swimming, a little drinking, a little sunbathing. Way to go. Enjoy it. You deserve it, Sutton. Rotary in the News. How many of you have gotten your Rotary in the News magazine? How many of you read it? Good stuff, right, Gordy? Good pictures, good articles? Well, in speaking of magazines, I don't know how many of you get the Edina magazine. You get that too, Gordy. Good. Well, in the January issue of the magazine, there was an article about our club, and the title of the article was Giving Back. The Rotary Club of Edina partners with my very own bed to give local kids a good night's sleep. Past President Paul Moody is pictured with Michael Allen, the founder of My Very Own Bed, and 2 others from the organization. It is a great article about our club, about people like Paul Moody that give so much, and it all happened because our public image director, Katy Campbell, orchestrated it and made it happen with the article from Edina magazine. So way to go. Now, as Wooge will tell you, it's important for people to know about our club. Not necessarily just to blow our own horn, but they can understand what we do as a Rotary Club of Edina to serve to change lives, how we might be able to benefit them. We have 41 local grants applications, and possibly consider joining us. We're looking for new members. Andrew Gump, maybe in a couple of years you can join us. So to that end, we have an opportunity. David, we have a lot of opportunities. And that opportunity is for everyone to get a Rotary Club of Edina hat, or maybe a polo shirt. You can go to Rotary Club Edina, go to our website or talk to Becky and you can order it. And so I know Bob Solheim's saying, well, when would I wear a Rotary hat? I said, well, Bob, you might wear it at the car show, like last fall when we had 700 people there. They're walking around and say, oh, you're a Rotarian. Or you might wear it when you're delivering beds for My Very Own Bed, like Mark Staggerberg did, and Mary Swinson and her husband. Or maybe when we delivered the 95 Thanksgiving baskets to needy families in Richfield, Bloomington, and Edina. And again, it isn't about blowing our horn, but it's making people aware of the Rotary Club of Edina and all the things that we do for good. So, again, other opportunities that we have coming up. We have a Black Business Mixer the 4th Thursday of every month, and the first one is going to take place next Thursday, the 24th, and it's at Pimento Jamaican Kitchen. And it'll be great fun, great food, great drinks, have the opportunity to mix with other business owners and professionals to network. We also have another opportunity that we need help with, and who's going to come up and talk about this? All right, our youth chair director, Andre Brewer. Give it up for Andre.
All right, how's everyone doing? All right, so on Tuesday, March 8th, we are going to do our leadership ethics seminar that normally is in the fall, but given COVID and everything, we were able to get it finally scheduled for March, it's up there. It will take place at St. Patrick's Church, where it always happens. Sutton McGraw and John Butop have been working really hard on making it one of our best yet. Sutton has been going to the school, down to high school, to meet with students in various organizations. She's actually going to go tomorrow to meet with the Senate to review some of the scenarios or case studies, thank you, better term, that we will be doing during that time. What we need from you guys is we are in need of at least 8 to 10 other table leaders to assist us with the students, and just more so, I like it because we get to listen and learn from them more than us talking and having to sort of be like the leaders, if you will, of the table. So if this is something you would love to do, please contact myself or Sutton or John so we can get you down for that. It takes place on Tuesday the 8th. Your commitment is from about 8:30 a.m. until around 2:30 p.m.
They get lunch?
And they even get lunch.
All right.
There you go. Thank you very much.
Thank you, Andre, Sutton, and John, who have worked tirelessly to make it happen. I mean, maybe Lindsay Smaka could speak of policies and procedures of the Edina School Department, but it's been jumping through hoops, but it's going to happen. I'm so excited. Another opportunity. How many of you are familiar with VEAP? Raise your hand. Huge food bank. How many of you have volunteered at VEAP doing one thing or another? Maybe more. Well, forgive me, I'll be very brief. But March 9th, 6th, 4th, and June 1, we're looking for 5 to 6 Edina Rotarians to pack lunches for kids to have over the weekend whose family can't do it. And also, big news, I know you was wondering what it is. The big news is that our club, along with the Edina Country Club, is going to do a March food drive. And so we're going to be asking for non-perishable items. So if you could do a little shopping before you come to the meeting, maybe diapers, maybe banking essentials, maybe birthday cake mixes or laundry detergent or personal care. Stay tuned, we'll let you know, but that's all going to happen during the month of March. So hopefully we can inundate VEAP with stuff that we get. Bring your diapers, yeah. Specific sizes. Birthdays. Who doesn't like celebrating birthdays? Deidre Cavell celebrated her birthday. Sue Parrott celebrated her birthday. Becky Mikowski did. Gitu Sharma, in fact, I know what she did with her friends. Jennifer Hendrickson, she went diving with the sharks. Brad Hepp, Dr. Steve Eaker, Harold Hansen. Susan Johnson's got hers coming up. Lindsay Smaka's got hers coming up. Dr. Sharon Chandler, Mike Martin, and Mike Hallis. There's one person whose name is not on there that I wanted to mention, and that is none other than Bob Stellick, who 19 years ago in 1 week collapsed on the tennis court with a massive heart attack. And last week he celebrated 19 years of being alive and being with us, and we're so glad. Certainly the Lord had plans for him for another 19 years, and as he told me earlier today, maybe another 30, maybe another 30, Bob. Rotary Anniversaries. I'll go through this real quick. The sad part is we don't know who invited these people to join our club. Please think about who you could possibly invite. A colleague, a new worker, a neighbor, somebody that would enjoy being part of our club so they could truly make a difference. So let's see, Ken Anderson, 23 years, John Cardell, 20, Joe Christensen, 21, our new member Gay, who's already done so much, 1, Bjorn Frudenthal, 6, Wayne Harmon, 36 years, Bob Hildreth, 36, Joel Jennings, 34, Charlie McGoldrick, 21, the man that runs the city of Edina, Scott Neal, 11, General Jeff O, 19 years, Carlin Padiachi, 1, and Sue Parrott, 23. Again, that says so much about what our members give to our club and also how much our club means to them that they're going to want to participate. Okay, it takes a village to put on a Rotary meeting. Our greeters today are Sandra Krebsbach and John Mazzara. Rich Melzer is helping out at the front desk along with Becky, and he will be introducing our guests and visiting Rotarians. Take a big one, Mark. Sandra Krebsbach will be leading us in the Invocation, Pledge of Allegiance, and four-way tests. Katy Campbell will be introducing our speaker, and John Mazzara will be thanking our speaker. Eric Reese, I saw you. You're here. Thank you for writing the Barker and making it interesting and all that. We appreciate it. Our very own Chris Lakowski is filming us so we can put it on YouTube. And Ryan Wilson, the rock star, is there helping out on Zoom, facilitating that. Please rise for the Invocation, Pledge of Allegiance, and four-way test.
Good afternoon. This invocation is based on the work of Henri Nouwen, a Dutch priest who lived in the United States and Canada. I was introduced to him by Dr. George Shapiro at the University of Minnesota in my PhD program. And it's really on a philosopher's view of hospitality, and I thought it really fit Edina, particularly Edina Rotary, because hospitality is a marquee of this club. Hospitality, it means primarily the creation of a free space where the stranger can enter and become a friend instead of an enemy. Hospitality is not to change people, but to offer them space where they where change can take place. It is not to bring men and women over to our side, but to offer freedom not disturbed by dividing lines. The paradox of hospitality is that it wants to create emptiness, not a fearful emptiness, but a friendly emptiness where strangers can enter and discover themselves as created free to sing their own songs, speak their own languages, dance their own dances, free to leave and follow their own vocations. Hospitality is not a subtle invitation to adore the lifestyle of the host, but the gift of a chance for the guest to find and value his or own lifestyle. And now, the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. And the four-way test. Truth. Is it fair to all concerned? will build goodwill and friendships, will be beneficial to all concerned.
Please welcome one of our newest members, Rich Melzer, who's going to introduce our guests and visiting Rotarians. And Gordy, did you know Rich is starting a new job on Monday as a CEO of Youth Link in downtown Minneapolis, helping at-risk teens? Now, we can all think about when we started our new job, so let's give him a little encouragement. He's going to be a rock star. He already is.
Appreciate that, Michael. Super excited to introduce today's guest, so we'll get right to it. Our first one is going to be our guest speaker today, Katy Campbell. Do you want to welcome Patrick?
Two people. John Magnuson is our guest speaker, and a friend, Patrick Reardon, visiting today.
Welcome.
Welcome.
And Brother Wooge. Wooge, you have a guest today. Wooge.
This is a friend of mine from law school, Aklilu Dunlap. I am so glad that there are still reasonable lawyers out there. His hourly rate is only $350. His daily rate is only $3,000. Yeah. So if you need a good lawyer, contact me.
Wooge, maybe you can get him to give us the Rotary discount too, if you think about that, okay? David Clynes, you have a couple guests here today.
Larry, stand up.
Stand up, Larry.
Jimmy, stand up.
Put him on the spot.
These are, Larry here is my cousin, Larry Fighton. He's recovering alcoholic and a leader, does a great deal of counseling and leadership in the recovery area, and I wanted to make sure that he was here for this event. And then this young man here is Jimmy Barnett, and he's in charge of the youth at our St. Stephen's Church across the street, the high school kids. And so he used to work at, some of you all might know him from St. Pat's, where he was before. So those are my two guests.
Awesome. And we have another handsome young guest here I had the pleasure of meeting who's sitting at our table, thankfully, today. Catherine Gump, do you want to welcome this young man to the group, please?
Delighted to have my son Andrew here with us today.
Yeah, welcome, Andrew. That's everybody. Thanks, guys.
Let's give it up for Andrew.
I am chopped liver. I am chopped liver.
All right. Hi, I'm Andrew Gump. I'm a member of the Edina Interact Club at the Edina High School. This upcoming Saturday, we're hosting our Skate 10 Polio at Braymar's backyard rink from 3 to 5:30. All proceeds from the event go to the Rotary Foundation's End Polio Now campaign. You can either come at the start or come near the end, whatever works for you. You don't have to stay your whole time either. Tickets are $20 for adults and $10 for kids under 12. And even if you aren't able to come and join us, we'd be happy to take donations because it's an important cause to eradicate polio. Even though it's not here, it's still happening other places, and that's really important that we stop that. To buy tickets, you could scan the URL, the QR code on your sheets, or go to this tiny URL link. And we also accept checks and cash at the event. Ms. Smaka's Venmo is at the bottom of the form. And if you need any assistance, Ms. Smaka and my mom over there would be happy to help. Thanks for supporting Interact in our Skate 10 Polio event.
I'd like to welcome a man who needs no introduction, the man with a big thumb, Bill McReavy.
Thank you, Michael. Come on up, David. It is certainly my privilege and honor today to do something that I've never had the opportunity to do until now. I've been part of the club for 25 years and I've never done this, and that is present David Clynes with a major donor pin. And so what a privilege. And I think Catherine is going to make her way up here to help me with this because, when I think about this, I think about David's mother and his dad, Bill Clynes, who was a huge part of our club, and what a legacy that David continues on. And I need assistance in pinning the pin because I have two sayings. One is, and my sons know this, number one is always come back stronger. Second is learn from other people's mistakes. I never could understand how anybody could slam their thumb in their own car door, but I managed to do it. If you want to know how I did it, have your people talk to my people. So, David, congratulations. Come on up. Let's pin you first.
Thank you so much.
Just fine. Looks good. Uh-oh. Okay. You paying attention back there, Koshi? Okay, here we go. So, thank you. Wow, that's bright. I've been a member of this operation formally since 2014, but my dad, as you all know, was a member starting in 1976, and he instilled in me the enthusiasm and joy of the Rotary community. My dad was a big supporter for many years. We lost him in 2020, but he was here participating as much as he could. So from him and my folks, I've inherited a legacy that I want to be a good steward, and I want to continue to support the programs that I know about. I want you to take out a piece of paper because I'm going to tell you two things that you're going to need to know and take home with you. The one thing that I think about is, so why giving, but then why giving to the Rotary Foundation? Simply put, I mean, when I give and share my resources, it lifts me up. It doesn't just make me happy, it brings me joy and continuous joy. Make me feel like I'm participating in something bigger than me, that I'm helping out others that might have a specific need, whether that's helping a kid with his calculus or pitching in money to eradicate polio. It lifts me up and makes me feel better, so that's why I do it. The Rotary Foundation is why specifically the Rotary Foundation. The thing that comes to my mind, of course, my father always said he spoke very highly of the organization and told me all about it for years. But the thing that impresses me is that the local, we partner for the international projects. We partner with local clubs, local people, not necessarily governments, and sometimes it's a good thing, not the governments. But we partner with the local team of people there on site, and they help us come up with the best plan that will be there to last, and not just fiddle away as soon as our taillights leave the parking lot. So it's a long-term operation that's been successful for many, many years, and it's getting better. We're trying to make it better. Another part that's been close to my heart is the Rotary Scholar Program, which is also funded by the Rotary Foundation, and we have now that's called the Global Scholar Program. So the one thing I want you to write down is you can go to the district website, and there's a link on the top that talks about global scholars, and the idea is that some student who is past college, a graduate student, can go and study anywhere in the world on some subject of how to make the world a better place. You can't get a global scholarship in fashion merchandising, but you could get a global scholarship in, say, hydraulic engineering or water quality or things like that. And I would highly recommend, if you know anybody that's available or interested in that at all, to have them apply, because it's a great deal. One of the benefits, or we're a beneficiary of that program in that we have my Rotary brother Wooj was a Rotary scholar back in the 90s, and my family we were involved in supporting him while he was here, and he's a friend that I will have forever, and I'm very fortunate to have him as a friend. But that leads me, the partnership thing, and the other is that we're doing this together. We're not doing this alone. When you travel, the one thing I want you to, other item I want you to take home is, when you travel and you go to Malmo or you go to Madison, go check out the local Rotary Club. There's an app on the website, on your phone or your gizmo called Club Locator, and you can go in there and you can find the club that's in that area, and you go and you can just show up, and you'll be a welcome guest immediately. I did that in Stockholm and London, and it made the trip a whole lot more exciting and interesting. So I'll leave you with that. Please, Rotary is not just noon on Thursdays at the Edina Country Club. There's a community all over the world. I have now, through the Scholar Program, I've probably got 50 Rotary siblings, I call them, that are in countries all over the world. One of them's a bishop in the Church of England. She's a bishop in the Church of England. One of them's in charge of the Hyatt Regency operation in Thessaloniki. There's several in Japan, all over the place, and I look forward so much to going visiting each and every one of them as soon as we get done with this liturgy that we're dealing with. So, all the best. Thank you very much for this. And
thank you, sir. Thank you. Thank you. Congratulations.
David, you spoke from the heart. Of course, that's what we wanted. Hard to believe David and I graduated from Edina West in 1976. You know, he graduated with honors, went on to get a civil engineering degree or something, and I just graduated, so. Seriously, you know, one of the things I like best, and let's see, I think Eli's here, Tom Cook is here, when he said, you know, Rotary is just not Thursdays at noon in Edina Country Club. It's a lot more than that. So yeah, live it. And we'll talk about opportunities that you can live Rotary outside Thursdays at noon. Moving along. Our speaker, Katy Campbell, has a very interesting Rotary story, and she's extremely proud. California had paved the way for women in 1987. Did you know that, John Batoff, being from California? They were the first clubs in the country that allowed women to join them. Of course, you know, the Rotary Club of Edina was number 2, but they were number 1. Anyway, she joined a morning club in the Palm Springs area. At the time, she was only 26, and she was new in her newspaper reporting career, a gal from Iowa originally. 3 years later, she had the honor of serving as president of the club. Some of us want you to serve as president of our club, Katy, and she says, no, I don't know why, but anyway. She had the opportunity to attend the International Convention in Mexico City. She's remained passionate about introducing Rotary early in one's career, sharing the Rotary story as a mentor, showing up for Rotaract events, and encouraging all new club members to get involved as soon as possible. Her Edina Rotary involvement started in 1993 when she moved here and was editor of the Edina Sun Current. She met her husband, Ralph, and he joined the Morningside Club, and they were active for several years. Though she took some time off, she joined our club in 2016, wasting no time. She helped with photography, coordinated the blood drive, and in 2019 served as a gala co-chair for a very successful gala. Now serving in 3 significant areas: public image director on the speaker committee, and for District 5950 active with the Lake Street Partnership Project. Please welcome my dear friend and fellow Rotarian, Katy Campbell, who is a rock star. You just have no idea. It's true, you are.
I think that was longer than the program. Sorry about that. Leave a little room for it. Thank you, Michael. Lovely introduction. So on to today's featured program. When the Virginia-based National Home Infusion Association needed a vice president for government affairs, they turned to our speaker today, John Magnuson. We needed an experienced person who's familiar with how Congress works, the director said. John, by then, had many years serving as a campaign manager and field representative for the late, and I'll add, widely beloved Congressman. We had Jim Ramstad, Representative Jim Ramstad. You may know Ramstad was a huge advocate legislating for recovery services for addiction and mental health issues throughout his career, and as a top trusted advisor, John Magnuson was honored to read the Serenity Prayer, among other things, at Ramstad's funeral in 2020. John's career, so I'm going to pay homage to that too. John's career, and really I think his passionate calling, is continuing to advocate across our country to innovate shared agency and organizational pathways to recovery, to integrate mental health, substance use disorder, and well-being. Any agency you can think of related to addiction recovery services, John's been consulted with and worked with. Everything from the top U.S. Department of Health and Human Services to Hazelden Betty Ford, MAD, the Johnson Institute, and locally the Retreat. He's presently the executive director of the Minnesota Association of Resources for Recovery and Chemical Health. Let's call that MARRCH. He's a proud father to two teenage daughters, and he lives in Minnetonka. Here to tell us the very latest of what's happening in this important field, please help me welcome John Magnuson.
Well, thank you, Katy. Appreciate the invitation. Thank you, Michael, for your leadership and service. And thank you to Ralph Campbell, Katy's husband, who is a near and dear friend, and my friend Patrick, who I'm not certain where he is now, but he is here. Coming to Rotaries, especially this Edina one, is nothing new. I used to be the sidekick holding Ramsted's coat. And as I'd be leaving with him, you'd all be grabbing me saying, hey, why don't you join Rotary? Well, the downtown Minneapolis club got me, and so I'm also a past Rotarian. And when I moved from Minneapolis to Washington, D.C., I joined the Washington, D.C. Rotary. So love what Rotary is, what we do, and thank you all for remembering those four-way tests. Kudos to David. What service, incredible example, and thank you. And Rich, good luck with your job, and Dr. Brooker, thank you for your work. There's a lot that's changing in this space of mental health, substance use disorder, and well-being. And a lot of times all of that doesn't line up together. And so let me start by saying, though, actually asking a question. What's the leading cause of death in America right now? Anyone? Stress, cancer. It's heart disease, with stroke being the major. Yet the 10 most common health issues are physical activity and nutrition, overweight and obesity, HIV and AIDS, and then the big three: tobacco, substance abuse, and mental health, followed by injury and violence, environmental quality, immunization, and access to health. And so while the number one killer of people may be heart disease, I argue that the number one health issue that we're dealing with is untreated substance use disorder and mental health, the co-occurring conditions. And what is it that's the biggest inhibitor to people wanting to gain access to that? Anybody? Shame, pride, stigma. Stigma is it. It's all built into that. Everything that everyone said is what stigma is built into it. Well, some of you, and I know many familiar faces here from back in the days when I worked with Jim Ramstad. Stigma is what kept me from seeking help. I'm working with the guy who's a national leader on helping people with recovery, and the only thing that I would have had to do is say, I need help. But I didn't. It took run-ins with the law. I was kind of neat about how I ran things. I kept my life compartmentalized until there was that meeting that I was supposed to be at, and I wasn't. And Jim called me. He's like, Mags, where are you? And I'm like, I'm an alcoholic. And he said, well, you're not an alcoholic. I'm an alcoholic. He said, have you ever? And I said, yes. And he said, have you ever? And I said, yes. And he said, have you ever? And I said, yes. First time in my life I had ever answered those questions honestly. Not that I hadn't been asked them before, when I had a little run-in with some law, different points in time. But that's that stigma. That's what it is that when we have a challenge with something, we don't want to deal with it because we don't want to become what it is. And that's where I start by saying, my name's John, I'm an alcoholic.
Hi, John.
Oh, thank you. And I don't say that because that's the way that some 12-step groups read it. Right? I say that because in America right now, we're looking at that people are more than what their disease is. So the language that we use does make a difference. But I'm not ashamed of being a person that's an alcoholic because I'm more than that. I'm a person in long-term recovery. I'm a person that, that because of the ability of getting treatment, has a lovely family, has a successful career, and that's what we do. We get help and we move on. And so part of the disjointedness around this is our look at pharmacological solutions. We've been using those as humans since the beginning of time. The Chinese, well, in the Chinese dynasty, they used opium. They used that as their recreational drug. In fact, they also got addicted. Native Americans, as part of their spiritual experience, used psychoactive drugs. And then, of course, the European settlers to America brought with them distilled spirits or distilled alcohol, which right there, just look at it. We've got a variety of different chemicals. And that's, unfortunately, how we viewed these issues, is in little silos, broken into different pieces when they're actually all connected together. In fact, Dr. Benjamin Rush, back at the time of our founding of our country, he brought forward the disease concept of alcoholism. This isn't anything new that we've been dealing with. But how did they solve it? What were the innovations of that day? Well, inebriate homes, insane asylums, elixirs, which to treat alcoholism, they gave you cocaine. Well, there's a great idea, Until about 1935, when a couple of the guys ran into each other and they said, I think you got a problem, and can I help you? And that ability to get outside of oneself, to start to see that there might be something other than this thing that's ruling you and causing your life to change, and for you to change the values and the morals and everything else, really set forward a movement that brought 23 million people into recovery. And really, it's the bedrock of the industry that I now represent, is that building off of that, Minnesota, they named it after us because we were the pioneers in it. Hazelden and St. Mary's, those are the groups that, perfected the Minnesota model of treatment. The problem is that Minnesota model of treatment only works for about 50% of the people, 50% of the time. And you know what? Some people call that a failure. I don't. When you're looking at it, something as complex as an addiction and mental health, and we're all trying to move towards well-being, I call that a great success. But, everybody's got their thing that they want to sell and bring forward, and so they compare things against each other, when in actuality, we need to build upon things, because dealing with mental health issues and substance use disorder, and again, moving towards well-being, it's a very complex medical condition. There's medical, biological, psychological, social, spiritual components that all come together to create this medical condition. One acquires it through genetics, consumption, as we saw during the opioid epidemic, or environmental factors like traumas that may have happened. Right now there's a big talk in our country that the opposite of addiction is connection. You were talking about hospitality. Hospitality is what recovery communities are. They say, look, we don't care what you are, what's happened. Come on in. Let us love you until you can figure out how to love yourself. And that's where, I talk to the doctors at the Mayo Clinic, and they say, John, right now at this point in time, we think we might be looking at the iceberg when we're looking at addiction and mental health. It's just the tip top. It's only what we know. And that there's so many different ways now in what we're learning in the genetics, in the analytics, in the psychosocial. Hazelden is actually, we all know Hazelden is the place of SUD treatment. They're looking that, a lot of people have become more comfortable at this point in talking about a mental health issue. So if that's the door you want to walk through, great. If you now don't have a stigma around an anxiety or, depression, and you've been using chemicals, and that's the only way that you can see what your issue is, then that's great. Let's bring you through that doorway, because again, what we're trying to move you to is a state of well-being. Moving you from where you were to where you want to be. Because I guarantee there's not a person that is dealing with a substance use disorder or a mental health issue that wants to stay where they're at. And that's the part where, as we look at those changes, there's also changes that have been happening in our healthcare system. The ACA, anybody know what that is? The Affordable Care Act or Obamacare? I don't care what you call it, just like I don't care if you call me an alcoholic or a person in long-term recovery. There's lots of things that we call things. We don't have to argue about those. What we have to do is we have to look at what does it accomplish. And what the ACA accomplished is moving us from a sick care system where we were paying through fee for service for all the things that they would treat on your sickness, to now we have a healthcare, the beginning, let me rephrase that, we are far from having a healthcare system as we need or want, but we're at the beginning of having an integrated healthcare system that's starting to look at disease management. And again, let's not leave it to the medical experts. We know what happens when people left to their own devices can bring about all sorts of things. Let's make sure that as a part of that look at disease management that we bring in the consumer voice, the patient voice, and keep that as a big part of what we're doing. Right now in the legislature, there's calls from some in the state Senate that there should be a Department of Behavioral Health. That, again, this issue is so big that it should be pulled out and have its own agency. And if it's not an agency, then maybe its own cabinet level position. Somebody that could, work with the Department of Human Services, the Minnesota Department of Health, the Department of Corrections, the Department of Education, because all of those right now I work with on a weekly basis. Why not do something like that? And that's the part where we've got to agree that, look, this is America's #1 health issue, because when we solve this, our criminal justice goes down. When we solve this, our social services go down. So our group has been working a lot at the state, and looking at the changes that need to be made. The part that regulates this area in law is called 245G. So of course, what did they name it? 245G. I might have called it something like the innovative ideas for looking at how we integrate mental health and substance use disorder. But the geniuses came up with 245G. But in that, and I say that tongue in cheek, it's just the way it is. In 245G, they went and looked at the language, and that if we are moving from, who first off, how many days is treatment roughly? 30. 30? And where do you go for that? Do you go somewhere? Yeah. Treatment center. Treatment center. And is that how most people understand treatment today? Okay, well, that's how it was about 20 years ago. That still exists, but we have so many different modalities and ways in which we treat people, because the severities of treatment, when you look at it and say, I don't just send you away somewhere, I can meet you here when the severity level is low. And therefore, when we don't do that, what happens? If you don't treat something, what happens to your house if you don't paint it? It breaks down. That's why it's important that we look at this on a continuum of care rather than on an episode of care. And again, you couldn't have that until you move from a sick care system to a health care system. But right now, we still have these silos that are in place. So there's mental health and SUD. And they say, great, you two need to work together. In fact, we're going to name it behavioral health, something that's neither one of you, and make you have to fight about it, So, the reality is that not one or the other is the doorway, because some people come in needing mental health services. Some people come in needing substance use services. And even there, the substance use disorders or substance abuse, how about we just call it substance use and don't put the negative connotations, because these aren't sick people that are trying to break laws. These are people that have an addiction that starts to rule their life, and they break laws. Now, I'm not saying, throw away, our laws. You do a crime, you're probably going to do some time. But we need to have a better understanding about what's driving those things if we're going to really truly understand how to prevent these things. And that's what we're really moving towards. Part of that too is looking at, though, that our system, if you wanted to access treatment, how do you do it? First off, it's kind of a mystery because it's a stigma. We don't talk about it. So you got to find somebody like, where's my friend that's in it so I can go find it, you know? That's crazy. That's crazy. So this year, our association is going to have a public health and wellness fair at the St. Paul River Center. You know, we've all lived through the pandemic. We've all experienced some level of mental health. Why not open up an opportunity when we have all of our people assembled for our annual conference to invite the public to come in and see that there are multiple pathways to recovery? There's, you know, pathways that are for a medication-assisted treatment. There are pathways that if, you know, you are culturally specifically motivated, if you're faith motivated, if you're gender motivated, if you are sexual preference motive. All of these are modalities of ways in which we offer people treatment now. And that's the idea of there is no one size fits all. And that's where, again, we're moving towards wellness and well-being. And how or where we meet you and you and you, we meet you wherever you are. And then we build personalized programs that come along with that. But the way that you used to access it was through a county. Well, we did direct access, which said, you can just call up anywhere and go get an evaluation. I don't have to go to the county first. But that was supposed to go into effect, but they didn't have the ability to get the systems to operate. So they had to do it on a dual track for 2 years. We're just now starting to get into that. And then the biggest thing that's changed right now is the 1115 demo, which starts to look at that we're moving into a continuum of care, which means that we have to then use standards of care, which means we have to have levels of care. Because if it's that I don't just send you somewhere, that I meet you where you're at, well, how do I know how to move your care? And so the American Society of Addiction Medicine was kind of the national body that created then the standards of care. And in that, we now know that I can move you from a high intensity, where maybe you're an inpatient for 30 or longer, or maybe you're outpatient, where you're utilizing a screen and other devices and tools and technologies. All of it's now utilized in how we treat and move the continuum forward. So it is a real privilege to be before you to share a little bit of this knowledge. And I just have one request, that if you agree with anything that I've been saying today, that you reach out to your legislators and let them know some of the things that we're working on right now. It's called our Pathways to Recovery bill, which has 3 pieces to it. One is the Article 1, which is patient services and supports. Great, now you've had treatment, we've stabilized your situation. You're not fixed, you're just starting. Yet we have nothing that gets you going. And so we're creating an on-ramp of additional supports and services that help that person be able to move into recovery successfully. 2 is our workforce retention and development. We all know workforce is an issue. We were talking earlier, where'd they go? Like, we had the pandemic and nobody showed up after, you know? I mean, what happened? Well, in our field, you'd come into our field and mental health had a higher pay rate. So of course, where do you go? You go over to the mental health. So we already had problems. We got big problems. And then the third one is the service preservation and access. And this is making sure that we update the systems to help move things forward. And there's a lot of great stuff in there. If you're interested, I'll share with the club a handout on it. You can go to our website to get it. There's a banner on our SUD and Treatment and Awareness Day, and the bill numbers are SF 3062 by Senator Wickland and HF 3414 by Representative Frederick. So that's how you can help as we're moving to evolve our system. That's kind of how our system and where some of the touch points are. And the idea is health and well-being. But we can't forget that there are substance use disorders and that there are mental health issues. And the more that we just make those a part of our conversation, the better off all of us will be in reaching optimal health and wellness. So thanks again for having me, and I'll take any questions.
Yeah, thank you for speaking to us. I'm wondering if you have any statistics or opinion about the impact of the pandemic on substance abuse.
Absolutely. One of the most staggering, well, first off, what do humans do when we get stressed? We may use a chemical. We may take the edge off, okay? So people have been stressed during the pandemic. Alcohol sales up 55%. Illicit sales off the charts. You know, the opioid epidemic, the number of deaths that we had during the time when we actually were still like paying attention before the pandemic has doubled in its number, and nobody's talking about it. In fact, I just heard yesterday Commissioner Malcolm Commissioner Malcolm from MDH say that we should expect an even higher number this year. And yet, just another day, you know, we're just going along. So those are the statistics, and yet during this time, you would think that our business would be booming. We're at below 2016 numbers of people accessing treatment right now. There's a disconnect going on, and we've been really working hard to get the governor and the legislature to recognize this. That's why we did our SUD Treatment and Awareness Week. We had hearings in the Senate and the House. So again, we need your help in saying to our elected officials, pay attention. There's a big problem going on right now. So thank you for asking that.
Can the private healthcare system that we have now handle these challenges, or must the government be involved, and to what extent?
So I was just talking to the governor about this issue, and we need all hands on deck. You know, somebody had mentioned AA. AA doesn't cost a dime. It's a group of people that get together and they've solved the problem, okay? That's great. We also have, I was talking to Optum in United Healthcare yesterday about looking at some of these ways that we can create new programs that are in a value-based care system that can bring about opportunities to integrate these services with people. And then, you know, our government, you know, those systems that we have to be updated and moved from where, again, it was looking at it as a short-term episode into recognizing it as a continuum of care. And so investments have to be made into things, additional treatment, but also those supportive services, and then looking differently on the front end of prevention. And I see I got the axe coming here, so I don't know if we have time for one more. Yeah.
Yeah. Do the people you serve represent general population in terms of gender, race, education, money? So, for example, are there more men, or are there less, you know, more people less educated, you know, poor? I mean, you know, what kind of people do you serve?
Yeah, our members serve everyone. We want to serve everyone. However, the statistics don't bear that fruit. In fact, Minnesota is on the lowest end of some of the biggest disparities when it comes to our Native American folks accessing treatment, and other BIPOC communities. That's something that everyone is working hard to address, as we are all as a community and as a state and a nation. But it's no different in our field and our space. And that's why some of the culturally specific programs are vitally important. If people don't see themselves in something, they're not going to access or want to take movement on it. And so we're actually we've been talking about how do you create pathways, because if somebody's not had access to understanding something, how then are they supposed to run something? And then how are they supposed to take on the entrepreneurial spirit to be able to go out and create something? So we're looking at how do we maybe create some of those pathways that help people that do want to enter into that be successful, because it's one thing to start, it's another thing to finish.
Yeah. Wonderful. All right. Well, John, thank you very much.
Thank you.
Good, Mike. Okay, super. Rotary is a global network of 1.2 million neighbors, friends, and leaders and problem solvers who see a world of people unite and take action to create lasting change across the globe in our communities and in ourselves. From literacy and peace to water and health, Rotarians are always working to better our world and stay committed to the end. In honor of your presentation today, we will make a donation to My Very Own Bed, a local nonprofit that provides new beds to children moving into stable housing. My Very Own Bed gives a new bed, set of sheets, blanket, pillow, and mattress pad, stuffed animal, and book to children who might otherwise go without. Thank you for coming today. Here's our gift. Wish you the best.
Thank you. Appreciate it. Thank you again.
Thank you. Thank you, John, for your humility, for challenging us to make a difference. By, what did Rich tell me? It's not hard if you just talk about it, right? Is that what you told me earlier today? Okay. Looking forward, to quote David Clynes, the Rotary Club of Edina is just not Thursdays at noon, Mark Justin, but we have other things we can do. But we have Interact Skate in Polio to help make a contribution to the Interact Club and go skating. Next Thursday, we have Mike Rakin, who's the son of a friend of mine who owns 5 restaurants, including Mill Valley Kitchen and Benedict's in Wayzata, who's going to talk about what it's like running a series of restaurants through the pandemic. We have the Black Business Networking Gathering next Thursday at 5:30 at Pimento's Jamaican Kitchen. On the what is next Saturday, the 29th? Wade, help me out. Sorry. The 26th at 12:30, there is a gathering of Rotary clubs at the Edina Community Center to help Afghan refugees. So if you have the time to spend a couple hours at Edina Community Center on Saturday the 26th, it's not up there, Ralph, sorry, to help out with the Afghan refugees assimilating into our community, please consider going. The City of Edina State of Luncheon is March 1st. The Vocational Happy Hour is Wednesday, March 2nd, from Paul Nelson from the Morning Club who's going to speak. On Thursday, March 3rd, we have Chad Greenway, who is a former Minnesota Viking, who also has a foundation, who's going to speak. That should be a great program. I've heard him before. Yes, the Leadership Ethics Workshop is going to happen thanks to the efforts of Andre, Sutton, and John. And if you can spare part of a day to help young people and moderate the table, would be much appreciated. Numerous VEAP packing opportunities, Rotaract Polar Plunge in Lake Minnetonka. April 12th, we're going to have another Days for Girls donation day. Stay tuned on what we can do for feminine hygiene products and clothes for young ladies in third world countries. And I don't know why Becky put up there the annual picnic on June 30th. But for all you new members out there, it's tradition that the new members put the new picnic on. All right. Asking for help is a first step. You are more precious to this world than you'll ever know. Lily Reinhardt. Meeting adjourned.